County. Kakamega will begin on Friday. Busia, being a border county, will play a big role in protecting healthcare workers, especially especially Busia health workers and thousands of who interact with thousands of truck drivers on a daily basis. Our reporter Willie Lusige joins us live now with an update. Lusige, good afternoon. How far is this exercise in that part of the country?
So in the entire western region, 2 counties have already launched the vaccination process. Yesterday that was in Vihiga, and today it is here in Busia, especially that now Busia plays a key role in terms of the border point, because here is where the truck drivers go to Uganda and other neighboring countries, and also the risk of being exposed to COVID-19 is very high. So today Vihiga, Busia County has begun that process of vaccinating healthcare workers and frontline workers, and I just want to speak to the people in charge before I show you on TV what is really transpiring behind me. Karibu sana kwenye KTN News. The process has begun. Maybe how many people do you expect to vaccinate?
Yeah, thank you so much. Busia County, we expect to vaccinate 12,000 people, but so far we have received doses for 6,000, and today we have vaccinated a total of 45, and the process has begun, and we are going on. There is a lot of eagerness among the people to be vaccinated.
So after that, what will be the next after vaccinating the 12,000?
Yeah, that's the first one. Just according to the national level, with us, Busia, we allocated 12,000. I think we shall go the next phase, where we are going to get the vulnerable people, people with other conditions, who will be in the next phase.
Okay. And apart from that, maybe how is the response? Are people willing to come and be vaccinated?
Yeah, thank you so much. Initially, people were skeptical, but from what we have done here, people have come to be vaccinated. In fact, we have received some people, 1 or 2 from the neighboring country, who also want to get vaccinated. So there is a lot of eagerness. People are going to come and be vaccinated.
Okay. What's your name and your position, please?
I'm Dr. Isaac Omeri. I am the Chief Officer for Health and Sanitation in Busia County.
Thank you so much. The Deputy Governor is also here. Have you been vaccinated?
Yes, my name is Moses Mulomi, the Deputy Governor and Acting CEC Member for Health and Sanitation in Busia County. I have been vaccinated this morning. In fact, I was the first one to be vaccinated. And I would like to say that this is a very, very important day for us since the onset of COVID. As you know, for the last 1 year, we have been challenged very extensively in the medical field by infections due to COVID-19. Now, the fact that the national government has been able to facilitate vaccines is a major step towards managing the COVID incidence. We know that as Busia, we were able to handle more than 2,000 patients who were infected with COVID. We were also able to test nearly 110,000 members of the public and truck drivers. This was a very, very extensive activity. We were able to test even in the villages, in the various sub-counties. Now, as a county, we established a COVID management and treatment center in Alupe, and have had a team comprehensively following up on all cases of COVID in the county. Now that challenge has remained, and we hope that as we cascade the vaccination program through the county, we shall be able to reduce and improve on the management of the disease.
Okay. And are you also working in partnership with the neighboring countries like Uganda? Are they vaccinating from there?
No, at the moment we are not, our program and theirs is not completely in tandem. But we hope, we know that they have received vaccines. We have not yet been able to get their program in relation to the fact that we are on the border. It's essential that we work together because we have a lot of cross-border activities which influence our ability to manage certain conditions. In this case, COVID, the people of Busia serve a lot of Ugandans in our hospitals, especially the border hospitals like Busia, Port Victoria, even in Kocholia. We get a lot of patients from Uganda because of the differential capacity status of our facilities. So we would like to work very closely with the Ugandan government to ensure that as we undertake this program, they also undertake a similar program to manage the disease.
Thank you so much, DG. That's the Deputy Governor here in Busia, talking a little bit about the process that they have begun today. It's all about vaccination for the healthcare frontlines, and apart from that, also those ones who are also vulnerable. So the process has begun, as the Chief Officer has said. They are targeting 12,000 people, but that is only the first phase, where they are also giving similar services to those ones even from Uganda. So we'll be following up to see what will transpire in the course of the week and even in other vaccination phases.
Thank you very much. That is Willie Lusiga, reporter, joining us from Kakamega on the vaccination exercise from the western part of the region. You're watching KTN News Desk. We want to take a short commercial break, but we'll be back with more news on the other side. Do stay with us.